Hey guys, my name is Sandra. I am a nurse practitioner and I am a friend of Jamil Mohammed's. We know each other through church. I was basically asked to talk to you guys about human development and how it kind of correlates with my role. So I went to University of Florida for my bachelor's degree in nursing, and I also attended there for my master's degree in nursing, which allowed me to sit for state boards to be a nurse practitioner. Um, I became a nurse because of a general love for people. I enjoy people. I enjoy hearing their stories, hearing about their lives. And when I was working on the floor, I just felt like there was so much more that I could do for patients as a nurse practitioner. So I pursued my master's degree and graduated in May of 2012. I currently work at the University of Florida in the gastroenterology department, and I really enjoy what I do. And I work with patients, getting them pre-op for their procedures, for colonoscopies, upper endoscopies. I go over their paperwork, give them prescriptions, order their test, make sure that they need the test, that they're warranted. I provide a lot of education for patients, and I think that it makes a big difference in their quality of care as far as the colonoscopy. So in regards to, more importantly, y'all, what I have found in my career as why it's important for me to understand human development in what I do, and what are ways that having this knowledge influences me as a clinician, and kind of applying that to adolescence, early adulthood, middle adulthood, and older adulthood up until death. Okay, because that is inevitable. It's going to happen to everyone. There's no escaping that. It's death and taxes, I think, are the two things you can't get away from. But yes, applying basically the physical, the cognitive, the social, and the emotional development, basically applying those four categories on those areas of development, human development. So I'd like to start talking about the physical. So of course we know it's the mind, the body, the soul. They're all a part of someone's physical. But what we're really going to be talking about here is the body, is the human body, and how understanding human development plays a huge role in how we deliver care. I'm actually an adult nurse practitioner, so I can only deliver care to patients that are from the age 13 and on. So that's important. If you're only allowed to care for a certain age range, then you want to make sure you understand why that is. And so what I'd like to kind of talk about is the treatment of people is based on age. It's one of the major factors that we play when we develop treatment regimens, when we come up with dose adjustments, and just seeing how the body is going to react to medications. We play those things play a really big role in how we deliver patient care. And so I think even specifically when I was an oncology nurse, I just remember the age of a patient being critical in developing chemotherapy, making sure that we gave the patient the right dose based on their age. As you get older, your kidneys don't work as well, your liver doesn't work as well, and so we want to be careful that we're giving medications to patients that's relevant to where they are in their development as a human. And so I think that's just kind of one way we can look at that, and why it's important. And then I'd like to move on to cognitive. So cognitively, we all develop differently, and just because somebody looks 15, you think that, oh, they probably have at least a 4-year degree. It's not the case. Sometimes they're not even able to read, and so you may come in to talk to a patient and ask them what they know about a colonoscopy, and you hand them a piece of paper and you walk out of the room. And sometimes I look at their faces and just see, like, is he paying attention to what I just laid down, or is he having a hard time reading this? And you'll find that some patients will honestly tell you, I don't know how to read. Or sometimes they'll say, I'm not that great at this, so my wife right here will help me. And so I think it's important to kind of determine how to present things to where they are cognitively, so that you're not talking over them or talking down to them. That you're able to present the information in such a way that a patient feels when they leave your office, that was really positive. I really felt like I got what I needed from that visit. I think that as providers, we play a really huge role in understanding where patients are, meeting them where they are cognitively, and kind of tailoring things to their needs. So that's kind of how I feel about that. And then how I apply that to my job is what I was kind of describing there. And I think socially, and in my mind, I kind of broke this down into like 3 major zones. I think cultural, spiritual, and and kind of like societal norms was kind of how I felt like this could be broken down. And so as you spend more time in certain cultures, you find that there are certain ways that older Asian Americans won't look at you as you speak to them. They look down, just out of a sense of respect. Whereas others prefer constant eye contact to show that they're intently paying attention to what you're saying, and not writing you off. So I think that's how in the older population, which is mostly what I deal with at my practice, you find that you've got to keep that in mind when you're talking with patients. And then also spiritually, if you're dealing with a Jehovah's Witness, they don't accept blood, and so you've got to be aware of, okay, is this an adolescent that's, this is their parents, that their views, is this the kid's view, or excuse me, not the kid, but is this the young adult's view, or is this the parents putting this on the child? And additionally, if the patient does feel that these are their convictions, then you've got to respect that as a provider. So and then also we've got different regions, different areas just within the U.S., but additionally, patients that are older, you tend to want to show more respect to, just because they fought for this country if they're veterans, or that's what their parents would have done. So you find that different societal norms of different regions, from New York to the Bible Belt, from veterans to young people. You just got to learn how to tailor your care, the way that you speak to them, the way that you present things to them based on that development. So lastly, I'd like to speak about emotional. I think that when you're dealing with such matters such as death, dying, major illness, such as cancer, or even relative, if some patients may feel like getting diabetes is a death sentence to them, and you maybe think it's not that big of a deal, but to them it is. And so you've got to know how adolescents, they want to feel like they're in control because everything's spinning out of control. Or for the elderly, they want to feel that you empathize with them and that you understand, and that they're the most important thing right then and there. And so in regards to human development, I feel like it is something that plays such a huge role in what I do every day that sometimes I don't really know that it's playing such a big role. But when I look back, and Jamil kind of asked me to do this video, I didn't realize how much it did just seep into every single day. I have to learn to tailor the way that I talk, the way that I relate, the way that I treat and diagnose and manage patients, as well as the way that I, explain and process with them. So I feel like that's pretty much the meat core of what I do, and how human development plays such a big role in what I do. So I hope that was helpful. If you have any questions, feel free to email me. Jamil has my information. So I hope you guys have an excellent day, and talk to you later.